Hello, welcome to another episode of Yummy Data Science. This is a series of videos dedicated to understanding healthcare claims data and related analytics. And today I will be talking about the key players in the US healthcare market with a view to understand what types of claims are generated. So there are three types of players in the US healthcare market. And one of them is the payers. These are the entities that pay for services, healthcare services rendered. And so a large section uh, of healthcare services are paid for by the government in the United States. And the entities in the government are Medicare, Medicaid, and CHIP, which is the Children's Health Insurance. And on the right here, you can see that the total US population is around 340 million, and the insured are around 315 million. The rest are uninsured. And of those, about 60 million are Medicare alone. So if you do your math correctly, you can figure out that almost half of the population of the US is funded by the government, and the other half, roughly, is funded by private um, health insurance payers. And of the private health insurance payers, the largest companies are United Healthcare. Then each state has Blue Cross Blue Shield. So the Blue Cross Blue Shield used to be a larger entity, and then it was broken up into the states. And then there is Kaiser Permanente across much of the US as well. Now, these are entities that pay healthcare bills, okay, to put it very simply. Now, who do they pay out to? They pay out to providers. So there are four types of providers in the US, and I'm going to give you a quick one-line intro on them in this slide, and the next one will focus more on the providers. So there are providers, facilities. These are buildings, brick and mortar buildings, okay? And so when you are billing from the perspective of a facility, you're thinking, okay, this room was used, this machine was used. You're not thinking about it from a perspective of a person's labor or resource. You're thinking about it from the facility. And professionals, that's another type of provider type. These are people with feet. So people go from place to place. So that will be important to keep in mind as we learn more about providers. The third type of providers are pharmacies. And these are pharmacies that give out medication to people who pick them up. And these days we can also have delivery services, but these are usually the CVSEs, the Rite Aids, the Walmarts, etc. Now, of course, you can get medication in other places as well, most notably facilities. But the way that the medications are billed in the facilities is different. When we are talking about pharmacy, we are talking about the standalone pharmacies. And the fourth type of provider, this is all other ancillaries. So, for example, labs, diagnostic labs, therapy, that's all lumped into ancillaries. Now, without the third kind of player, there would be no market because it's the members whose care is producing these bills. Members are also called patients or also called beneficiaries. Okay, so we talked a little bit about payers, providers, and members. In this slide, I'm going to go a little bit in depth into the providers. And I would like to talk about professionals versus facilities. This is pretty important distinction to understand as we talk about the two types of claims that they produce. So let's talk about facilities. And remember, these are buildings. So I've put a little icon of a building here to make it very clear that these are buildings. And examples include, well, hospitals. Hospitals are facilities, they're buildings that provide care. And skilled nursing facilities, another type. And the key characteristic of the bills they produce is the type of bill. And type of bill has a few elements in it, but most important thing to know is, well, what type of facility is it? Is it a hospital? Is it a skilled nursing facility? And then, is it inpatient? Is the patient staying in the facility overnight? Has he been admitted overnight? Or it's an outpatient. So that's a type of bill. And type of bill goes with the facility claims. The other kind of characteristic that's very important from a facility perspective, and I alluded to this, what department did the care come from? Um, and say you go to Macy's or J.C. Penney's, you might be in the women's section or the coat section or the shoe section. So a hospital, think about the hospital like that. There will be an emergency department, there will be lab department, there will be room and board, and behind the scenes, the hospital has a charge master. These are the fees that we charge for each of these departments and their services. So there is a revenue code, and which basically says which department is the charge coming from. So say the person is in the hospital and they are using room and food, room and board. So there would be a charge for room and board. On to the professional category of provider types. Professionals are people, and people have feet. We walk from place to place. And this is very important. So I've put a little icon of feet. We are walking from one place to another. And examples of this may be physicians, nurses, dentists, surgeons, whoever you can think of, like a person who is providing you with care. And the key claim characteristic, the key distinguishing feature about these people are that they have feet and they may see patients in their office, they may see patients in their home, they may see patients in the facility or the hospital or skilled nursing. So these are people who walk from place to place, and they're also telehealth. So place of service is the key defining feature of professionals. And lastly, the members, without whom there would be no healthcare claims process. So a member has an encounter with a provider at a place of service, um, or a member has a provider, has an encounter with a facility, either inpatient or outpatient, and that generates a bill or a series of bills. And those bills, because they're not final, are called claims. See, if you go to Target, yes, you can dispute your invoice, but it's called an invoice. It's a bill, it's a final bill. But this is a claim because it hasn't been adjudicated on. So the provider will bill the payer for services rendered, and they will give supporting evidence. So, for example, they'll say this is the treatment that was done for these for this set of diagnosis. So this was the problem that the patient presented with, and this was the treatment. So the description of the problems or the diagnosis is part of the supporting evidence. So then the provider will, submit that claim with this information, and then the payer adjudicates based on the supporting evidence and other documentation. So what other documentation? Things like, what is the member's plan? What is their health insurance benefit? Are they at that point a member? Um, and that brings me to, people get confused about claims adjudication. What is claims adjudication? It's simply the process where a bill is submitted to a payer who examines it with other pieces of supporting evidence and pronounces judgment. Is the claim to be paid? Is the claim to be denied, or is it a partial payment, partial denial, etc.? And the one other thing I will mention about members is members are obviously people, and there is a time element. So, was I with United Healthcare this month? And then something happened, and I switched to Kaiser Permanente. So then United Healthcare would say, okay, Renu was a member for the month of January. So it would be a member month. That's how they think about members. And continuous enrollment, the idea here is if I am with a plan for a certain length of time, then I'm said to be continuously enrolled. And this is an important concept for measuring performance of the health plan. How well did a health plan do? Then you would look at how many people were continuously enrolled, and out of those people, what was the health plan's performance in a diagnostic service, for example. The sources for this video came from my 2 books that I've written. These are SAS books. They were written a while ago, but I think they're still useful. I also have some other related classes. One is maximizing value and insights from your healthcare claims data, and I customize it to fit your needs. The other 2 classes are also customized: AI-powered data engineering. I believe that the productivity gains and the efficiency gains and the joy can be vastly increased from data engineering if it is AI enabled. And similar with AI accelerated data science, I have a few days class that is customized to suit your needs. Thank you for listening.